Hello viewers, good day to all of you. This is Dr. BK for you. So today I am going to continue with the palm. So in my first or my previous lecture on palm, I have discussed in detail about the orientation of structures in the palm and then about the every layer of the palm starting from the skin up to the deeper levels, that is to the level of metacarpals. We have seen layer by layer. Then we have discussed about how the disposition of the deep fascia and what are all the modifications of the deep fascia of the palm. Then we have discussed about the intrinsic muscles of the palm, namely the thenar muscles, hypothenar muscles, lumbricals, palmar interosseous and dorsal interosseous. Now, in this lecture, I will be discussing about the nerves and vessels of the palm. So, our learning objectives for today will be the distribution and course of median nerve and ulnar nerve. So these two nerves are concerned with the innervation of the palm, and we are not going to discuss about the radial nerve because we have already discussed the radial nerve in the extensor compartment of the forearm. It is mainly concerned with the extensor muscles of the forearm and cutaneous innervation of the dorsum of the hand. So the palmar aspect is completely taken over by the median and ulnar nerve and followed by the applied anatomy. Then the blood supply in the palm, the blood supply is mainly by the branches in the form of arterial arches. So the ulnar artery and the radial artery is going to form two arches, namely the superficial and the deep palmar arch, and from these arches they are going to give branches which is going to supply the digits, your digits or the fingers. Okay. So now before going into the innervation of the palm, the nerve supply of the palm, as we all know, the brachial plexus is mainly involved in the innervation of the whole of the upper limb. We have discussed in detail about this brachial plexus, and most of the nerves also we have discussed. So beyond the axilla or the upper part of the arm, musculocutaneous nerve and axillary nerve, and beyond that what happens is the terminal branches of the three cords, mainly the radial nerve from the posterior cord, the ulnar nerve from the medial cord, and the median nerve, the combination from the lateral and medial cord. So these three are the terminal branches of the brachial plexus which innervate the upper limb. So I need not discuss much about how this ulnar nerve is formed or median nerve is formed or the radial nerve is formed. Okay. Now coming to the median nerve, it is also called as the laborer's nerve or nerve of the forearm. Most of the muscles of the flexor compartment of the forearm is actually supplied by the median nerve. So flexor muscles, we have already discussed in the forearm that the flexor muscles are massive and extensive compared to the extensor muscles because they are anti-gravity muscles. They perform powerful actions against the gravity. So a lot of force is needed, and for which it is indispensable for the activities of the laborers who do very hard work, who lift heavy objects and so on. So that is why the nerve which is innervating these flexor compartment of the forearm is the median nerve, and that is why it is actually called as the laborer's nerve. So origin of the median nerve, as you all know, it is by two roots, by the medial root of median and from the lateral root of median. The combination of both forms the median nerve. Here you are able to see here the combination of the lateral root and the medial root of median, and this unit takes place in front of the third part of the axillary artery. So since it is derived from both medial root and lateral root, The root value of this nerve is C5, C6, C7, C8 and T1. So these three from the lateral cord, and C8, T1 is the formation of the medial cord. Okay. Now coming to the course of the median nerve in the flexor compartment, you are able to see the flexor compartment muscles, mainly the superficial group of muscles. Flexor digitorum superficialis, you are able to see here. The palmar pronata arteries is actually cut to show the tendinous origin of flexor digitorum superficialis. Here you have the flexor carpi radialis, flexor carpi ulnaris. The median nerve is going to enter the forearm between the two heads of the pronata arteries, and then what happens? It is passing deep to the flexor digitorum superficialis and the flexor digitorum profundus. In the lower part of the forearm, it is present between the flexor digitorum superficialis and the flexor carpi radialis. The nerve comes superficial in the lower part of the forearm between these two muscles, and of course the palmaris longus tendon also is present here, which has been removed so that it won't obscure the view of the median nerve. Now what happens is, it is going to enter the palm by passing deep to the flexor retinaculum. So it passes under the flexor retinaculum, or it is very much intimately related to the undersurface or deeper surface of the flexor retinaculum. So that means it is passing through the carpal tunnel. In the palm, it passes deep to the palmar aponeurosis. Okay, it is present deep to the palmar aponeurosis. We have seen well and enough about the palmar aponeurosis in our previous class. So it protects the digital nerves and vessels, somewhat protective in nature apart from providing firm grip to the palm. Once it emerges out of the flexor retinaculum, what happens is, it immediately divides into some branches, mainly to divide into two trunks, a medial and a lateral trunk. Okay, so we will see that one by one. Now here, so just before entering the flexor retinaculum, the median nerve will give a branch which is actually called as the palmar cutaneous branch of the median nerve. This palmar cutaneous branch will pass on top of the flexor retinaculum, and it will supply the skin over the central part of the palm and skin over the thenar eminence. It's a cutaneous branch, so it is involved only in supplying the skin. So I repeat, it supplies the skin over the central part of the palm and also the skin over the thenar eminence. Okay. So that is one branch given by the median nerve just before entering the flexor retinaculum. Then after passing deep to the flexor retinaculum, that is through the carpal tunnel, it emerges, and here in the palm it is present deep to the palmar aponeurosis. So the palmar aponeurosis again has been removed so as we will be able to see the nerve very well. In the hand, it is going to give muscular branches. Okay. That muscular branch to the thenar muscles is actually called as the recurrent muscular branch. That is, you are able to see here, this is the recurrent branch of the median nerve. From the lower border of the flexor retinaculum, the nerve hooks backwards. So recurrent means it travels in the reverse direction. So it turns backwards to supply the thenar muscles, that is your flexor pollicis brevis, abductor pollicis and opponens pollicis. So that is about the recurrent muscular branch to the thenar muscles. Then it is going to give digital branches to the digits, and thereby it supplies the lateral 3.5 digits. Okay, that is your thumb, whole of the thumb, the whole of your index finger, ring finger, and lateral half of the ring finger. Okay, so how it supplies? It first divides into a lateral ramus and it divides into medial ramus. You are able to see one lateral division and medial division. The lateral ramus is going to supply your thumb and lateral side of the index finger. whereas the medial ramus is going to supply the lateral or the adjacent sides of the index and ring finger, then the adjacent sides of your middle and ring finger. Okay, so that is about the medial ramus and the lateral ramus. Now we will see how actually it supplies. So first, the lateral ramus gives 3 proper palmar digital branches. So proper means one proper palmar branch to the lateral side of the thumb, another proper palmar digital branch to the medial side or ulnar side of the thumb, and then one more proper palmar digital branch to the lateral side of index finger. So it gives 3 proper palmar digital nerves for the both sides of the thumb and for the lateral or radial side of the index finger. Now this branch from the lateral side also gives a branch to the first lumbrical muscles. Now from the medial ramus, you are able to see from the medial division, it gives 2 common palmar digital nerves. So one common palmar again dividing into 2 proper palmar for the adjacent sides of the index and the ring finger. So one common palmar dividing to give 2 proper palmar digital branches. Then one more common palmar, 2 common palmar from the medial ramus. So second common palmar will supply the adjacent sides of the ring finger and the middle finger. So adjacent sides of the middle finger and ring finger. So lateral ramus gives 1, 2 and 3 proper palmar digital nerves. The medial ramus gives 2 common palmar, which in turn gives rise to 1, 2, 3 and 4 proper palmar digital nerves. From the medial ramus, it also gives a branch to the second lumbrical muscle. So these are the lumbricals you see here, to the second lumbrical, and it also gives a communicating branch or a communicating twig to the ulnar nerve. Okay. So that is about the medial ramus. So lateral ramus supplies the thumb and the lateral half of the index finger and first lumbrical. The medial ramus supplies the adjacent sides of the index and the index and middle and ring finger, and it also gives a branch to the second lumbrical. Apart from that, it also gives a communicating twig to the ulnar nerve. So if you look at the innervation, this is the cutaneous innervation of the palm of the hand. It supplies your central palmar skin over the thenar eminence, lateral 3.5 digits, and also it supplies the nail bed. Okay. It also supplies the nail bed at dorsum of the hand up to the middle phalanx. Apart from that, it gives articular branches to the metacarpophalangeal and interphalangeal joints. It also supplies branches to the dorsal part, that is up to the middle phalanx, that is the terminal or the distal and the middle phalanx. But the dorsal part of the proximal phalanx and dorsal part of this hand is mainly supplied by the radial nerve. Cutaneous innervation is by the radial nerve. So that is the dorsal aspect. As I told you, this yellow color one areas are mainly by the median nerve, lateral 3.5 digits, including the nail bed and up to the middle phalanx. Whereas the dorsal lateral part of the dorsum of hand, dorsum of the thumb and digits up to the proximal phalanx is actually supplied by the radial nerve. Whereas the dorsal aspect, the medial 1.5 fingers and skin over the medial part of the dorsum of hand is supplied by the ulnar nerve. Okay. So the applied anatomy of the median nerve, if the recurrent muscular branch is damaged, inability to oppose the thumb, opponent's pollicis, abductor pollicis, flexor pollicis does not work. Emaciation of thenar eminence, which means the thenar eminence will not be bulged out, it might become flattened because of the wasting of the muscles. Simian hand, the thumb gets adducted and extended, which we will see that in the next picture. So mainly the median nerve where it might get injured. In the wrist, any fracture on an outstretched hand, so fracture of the wrist bones. And in the carpal tunnel, we have seen the carpal tunnel syndrome, loss of opposition, flexion and weakness and abduction of the thumb. Okay? So there is a flexion and weakness of the abduction of the thumb if there is an injury to the median nerve in the carpal tunnel. So it also leads to ape thumb deformity. The thumb is actually adducted, extended and laterally rotated. So like an ape it is present. The thumb cannot be opposed and there will be wasting of the muscles. But the cutaneous sensation of the skin over the thumb and the central palmar skin is not affected because the palmar cutaneous branch is going to pass superficial to the flexor retinaculum. So that branch is not damaged. So that is the ape thumb deformity. So in the carpal tunnel, paresthesia altered, you get sensations, pin pricking sensations. Numbness over the digits, lateral 3.5 digits. Then it is mainly during early hours. Okay, and wasting of the inner muscles, as I already told you, loss of sensations over the lateral 3.5 digits. Okay. The next, which we are going to see, pointed index finger pinch test and the pen test. So pen test, when you give a pen to hold, so that grip, the hand grip should be formed. The precision grip, mainly the triangular grip, which we have already seen different types of grips. The writing grip, like a tripod, you hold a pencil or a pen. Pinch test is again pinch grip, to test the pinch grip, holding between your thumb and any other opposed finger. So all this is actually tested mainly in the index finger and the thumb. When there is an injury to the distal part of the median nerve in the hand, you cannot extend the second and third finger. Now why you cannot extend the third finger and the second finger is because your lumbricals, the first and second lumbricals, they are involved. Because they are involved, you know the action of lumbricals is flexion at metacarpophalangeal joints and extension at the interphalangeal joints. But you can flex because the flexor digitorum superficialis and profundus is not affected. Only the median nerve is affected in the lower area, distal area. So the adducted, you get in the flexed position, but you cannot extend the fingers when there is a distal median nerve injury. In case of proximal median nerve injury, what happens is you can't flex the second and third because what happens is the flexor digitorum profundus and superficialis is not acting, it is affected, and naturally it is taken over by the extensor tendons. So unopposed action of extensors. So the two digits are present in an extended fashion when the median nerve is injured high above. So mainly based on these two symptoms, you can understand where the median nerve injury has taken place, whether lower down in the palmar aspect of the hand or high above in the region of the carpal tunnel or more proximal to that. So the next nerve which we are going to deal today is the ulnar nerve. So median nerve we have seen, mainly it supplies the thenar muscles of thenar eminence, first and second lumbricals. Then it is going to supply the lateral 3.5 digits. Now coming to the ulnar nerve, it is also called as a nerve of the hand or musician's nerve because most of the intrinsic muscles of the hand, it is going to be supplied by the deep branch of ulnar nerve, which is necessary. These movements are necessary to perform any musical instrument. The root value is C8 and T1, and C7 fibers also are contributed. So it is the terminal branch from the medial cord of the brachial plexus. The root value is C8 and T1. If you look at the ulnar nerve, it passes superficial to the flexor retinaculum, but deep to the Guyon's canal. It passes in the Guyon's canal. Okay, I told you the palmar transverse carpal ligament. It forms a covering over the ulnar nerve. So it is a canal which is formed by the flexor retinaculum below and the palmar transverse carpal ligament above. Then it immediately divides into a superficial branch and a deep branch. So after passing above the flexor retinaculum, it immediately divides into superficial branch and a deep branch. So 5 centimeters above the wrist, it is giving another branch. You are able to see that is the dorsal cutaneous branch of ulnar nerve. So we will discuss about this after some time. So now we will continue with the superficial branch and the deep branch. So in the hand, superficial, one of the terminal branch, it is going to supply medial 1.5 digits. Okay. The deep terminal branch, it is going to supply all the intrinsic muscles of the hand. So here you are able to see the superficial branch of the ulnar nerve. It is called as the palmar cutaneous branch, which is going to supply the skin over the hypothenar eminence, and occasionally, if it is present palmaris brevis muscle, it also receives from the palmar cutaneous branch of the ulnar nerve. It is not from the deep branch. The palmar cutaneous branch, if at all the palmaris brevis is present deep to the skin, it supplies that. So in the hand, dorsal branch, as I told you, 5 centimeters proximal to the wrist, it passes deep to the flexor carpi ulnaris after giving this branch. Then it pierces the deep fascia and enters the medial side of the back of forearm. 2 to 3 digital nerves, which is going to supply the medial 1.5 fingers. That is the dorsal branch of ulnar nerve. So the dorsal branch of ulnar nerve will give one proper digital nerve to the medial side of the little finger and one common digital nerve which is going to supply the adjacent sides of the little and the ring finger. Okay. So medial side of the little finger and adjacent sides of little and the ring finger. So that is about the dorsal branch of the ulnar nerve. It is a cutaneous branch. So the dorsal cutaneous branch of the ulnar nerve. Now coming to the palmar aspect, you are able to see the superficial terminal branch. One proper palmar, direct proper palmar digital nerve on the palmar aspect, it supplies the medial most part of the ring finger or the ulnar border of the little finger. Then one common palmar digital nerve which again divides into 2 proper palmar digital nerves to the adjacent sides of the little finger and the ring finger. Okay, the little finger and the ring finger, including the nail bed. So dorsally the nail bed region is also supplied by the superficial terminal branch which is given on the palmar aspect. So that is the ulnar, one of the terminal branches of the ulnar nerve. In addition to supplying the palmar aspect of the medial 1.5 digits, it also supplies the nail bed. Coming to the deep terminal branch, it accompanies the ulnar artery between the abductor digiti minimi and flexor digiti minimi. So that is the hypothenar muscles. So it is going to supply by passing deep to these muscles and supplies those muscles. Then it will pierce the opponent's digiti minimi and it will follow in the concavity of the deep palmar arch. So here you are able to see the deep palmar arch will be present in the hollow or concavity of the deep palmar arch. The deep branch of ulnar nerve ends by supplying the adductor pollicis. So the deep branch at its origin gives 3 branches to the hypothenar muscles: abductor digiti minimi, flexor digiti minimi and opponent's digiti minimi. Then along its course it supplies the palmar interossei, dorsal interossei, 3rd and 4th lumbrical muscles. Okay, so 3 hypothenar muscles it supplies, then 2 lumbricals, 6 muscles, 4 palmar interosseae and 4 palmar interosseae and 4 dorsal interosseae, 8 muscles. So 6 plus 8, 14 muscles. Then apart from that, it also supplies the adductor pollicis, so 15 muscles, and it also supplies the deep end of flexor pollicis brevis, so 16 muscles. And apart from that, if at all palmaris brevis is present, that also is going to be supplied by the superficial branch of ulnar. So almost 16 and a half muscles on the hand it supplies. So that is why it is also called as the musician's nerve. Most of the intrinsic muscles, it is supplied by the ulnar nerve. Mainly the deep branch is muscular, and it is also gives articular branches to the intercarpal joints, carpometacarpal and intermetacarpal joints and interphalangeal joints. So they are also giving articular branches apart from the muscular branches. So if you look at the applied anatomy of the ulnar nerve, so mainly the sites of injury are in the wrist or in the hand. It might lead to ulnar claw hand. Okay, so ulnar claw hand means medial fingers, 2 fingers. They are somewhat flexed and wasting of hypothenar muscles. So again, what happens? This bulk becomes almost flat because of the hypothenar muscle wasting, and loss of adduction and abduction of all the digits. Why? Because you know that all the palmar interosseae, which is responsible for adduction, and all the abductors, which is carried on by the dorsal interosseae, is supplied by the ulnar nerve. So you get loss of abduction and adduction of all the digits. Cutaneous sensation from the superficial branch to the medial half of both aspects. Okay, again ulnar nerve is responsible for the cutaneous innervation of the palmar aspect as well as the dorsal aspect. And what is ulnar paradox? The more higher the lesion, the less pronounced is the claw hand. So if the ulnar nerve is damaged in the hand, definitely you get a very much pronounced claw hand. The claw hand is very much pronounced. If there is an injury, what happens is you don't get the claw hand. Why? Because more proximal level, the claw hand is less pronounced. If it is at the more proximal level, then naturally your flexor digitorum profundus, the medial half nerve supply is disturbed. Then what happens? You don't get the flexion of these digits, unopposed action of extensors. So that is why if it is more lesion is at a more higher level, high above the forearm or wrist, the less pronounced is the claw hand, which is called as the ulnar paradox. That is flexor digitorum superficialis. So distal interphalangeal joint is not flexed. So coming to the applied anatomy, so we have already seen the testing for the palmar interosseae, the card test we call it as. So the person who is performing the test helps to pull, but you have to hold the sheet of paper or card against resistance to test the integrity of the adductors, palmar interosseae. This is Egava's test. Middle finger has to be abducted, or you can also test by the dorsal interosseae. You try to abduct your hand when against the resistance. When somebody is trying to actually adduct, you resist it by abduction. So how powerful your dorsal interosseae is present. So this is another test to prove that. So to summarize the ulnar nerve in the hand, it gives superficial branch and the deep branch. Superficial branch mainly supplies the lateral 1.5 fingers, the palmar aspect, including the nail bed, and it also supplies the palmaris brevis muscle. Deep branch of the ulnar nerve, it is present in front of the metacarpal bones, in the concavity of the hollow of the palm, in the deep palmar arch. In the concavity of the deep palmar arch it is present, and it ends by supplying the adductor pollicis muscle. So along its course it supplies 3 hypothenar muscles, medial 2 lumbricals, that is the 3rd and 4th lumbricals, 4 palmar interosseae and 4 dorsal interosseae, and that also gives articular branches to the intercarpal and carpometacarpal joints. So we have finished with the nerves of the palmar aspect of the hand. Now coming to the arteries. So the arteries of the palm, you have the terminal part of the ulnar artery and the terminal part of the radial artery. And apart from that, they are also going to form two arches. One is the superficial palmar arch and other one is the deep palmar arch. So we will see this one by one. So if you look at the ulnar artery, again it is passing superficial to the flexor retinaculum along with the ulnar nerve. Okay. So the ulnar nerve is present medially, and more medially is your tendon of flexor carpi ulnaris. Runs deep to the palmaris brevis, and it divides like the ulnar nerve only. It divides into a superficial branch, and you are able to see a deep branch. Same like the ulnar nerve, it divides into a superficial branch and deep branch. The superficial branch is the direct continuation of the terminal part of ulnar artery. Okay. So the direct continuation of the terminal part of the ulnar artery is the superficial branch, which is responsible for the formation of the superficial palmar arch. So the superficial palmar arch is mainly formed with the terminal part of the ulnar artery, 3/4, and 1/4 it is going to be contributed by any one of the branches of the radial artery. So that is by the superficial branch, palmar branch of the radial artery, or one of the branch of the radial artery, that is the arteria princeps pollicis to the thumb, or by one of the branch of radial artery, that is the arteria radialis indicis. So superficial palmar arch is formed by the terminal branch of ulnar artery and by the palmar branch, superficial palmar branch of radial artery or arteria princeps pollicis or arteria radialis indicis. These two are again branches of the radial artery. Now, superficially, or it lies deep to the palmar aponeurosis. So in a more superficial plane and on top of the flexor tendons. Okay, so deep to palmar aponeurosis but above the flexor tendons. The position or the location of the superficial palmar arch is at the distal border of the outstretched thumb. You stretch your thumb at the lower border, the superficial palmar arch lies. Okay, at the level of the distal border of the outstretched thumb. This superficial palmar arch will give branches. So you are able to see here through these branches it is going to supply the digits. First it gives one proper palmar digital artery. Okay. So totally 4 palmar digital arteries, of which the first one is one proper palmar digital artery to the ulnar side of the little finger or the medial side of the little finger. So direct proper palmar digital arteries. 3 common palmar digital arteries to the second, third and fourth interdigital spaces. Okay. Second, third and fourth common palmar digital arteries. So this will join with the palmar metacarpal arteries. We will see that later in the deep palmar arch. Palmar metacarpal arteries. So after that, that is, these branches are actually called as the perforating branches. They perforate and join with the palmar metacarpal arteries. After giving that, what happens is this common palmar digital arteries, they split into proper palmar digital arteries to the adjacent sides of the little and the ring and the middle and the index finger. Okay. So they supply the digits except the thumb and the radial side of the index finger. Okay. So one proper palmar digital artery to the medial side of the little finger, 3 common palmar digital arteries. They give perforating branches to the palmar metacarpal arteries. After that, each one divides into 2 proper palmar digital arteries to the adjoining sides of the little ring and middle and the index finger. So that is about the superficial palmar arch. Okay. So the next we are going to see about the terminal part of the radial artery. The radial artery we have seen and the lower part of the wrist passes via the anatomical snuff box. So the boundaries of anatomical snuff box are called abductor pollicis longus and extensor pollicis brevis, and then you have extensor pollicis longus. So between these muscles, the contact is the radial artery. Then afterwards it enters the dorsum of the hand. It is going to pass between the two heads of the first dorsal interossei. So it passes between the two heads of the first dorsal interossei. Then it is going to pass between the adductor pollicis muscle. So between the two heads of the adductor pollicis, it is going to pierce, and then it is going to come to the palmar aspect, where it is going to give two branches, arteria princeps pollicis and arteria radialis indicis. The arteria princeps pollicis supplies both sides of your thumb. That means it is the principal artery to the thumb. Then it is giving arteria radialis indicis, which means it is going to supply the radial side of your index finger. So these are the two branches, arteria princeps pollicis and arteria radialis indicis. Then after that it is going to take part in the formation of the deep palmar arch, continuation of the radial artery. So while the superficial palmar arch is formed by the continuation of the superficial branch of the ulnar artery, the deep palmar arch is actually formed by the continuation of the radial artery and completed by the deep branch of ulnar artery. So we have already seen the ulnar artery, after passing superficial to the flexor retinaculum, divides into a superficial branch which takes part in the formation of the superficial palmar arch, and deep branch which completes. So the major contribution of the deep palmar arch is by the radial artery and completed by the deep branch of ulnar artery. If you look at the position of the deep palmar arch, it is actually present at a higher level than the superficial palmar arch, and it is present at a deeper level, which means it is present deep to the flexor tendons but on top of the interosseous muscles, okay, and shaft of the metacarpal bones. In the concavity of the deep palmar arch, you will see the deep branch of ulnar nerve traveling, the deep branch of ulnar nerve giving branches to the intrinsic muscles of the hand and ultimately terminating at the adductor pollicis muscle. So that is what I told you, it is present between above the interosseous muscles but deep to the flexor tendons. So here it is present at the proximal border of the outstretched thumb, not at the distal border. The distal border corresponds to the superficial palmar arch. This is at the proximal border of outstretched thumb. So that is the surface anatomy for the deep palmar arch. It will give three palmar metacarpal arteries. These palmar metacarpal arteries will communicate with the common palmar branches of the superficial palmar arch through the perforating arteries. So it gives three palmar metacarpal arteries. Then it gives three perforating arteries. These perforating arteries will go behind and anastomose with the dorsal metacarpal arteries. Don't confuse these branches with the palmar metacarpal arteries from the superficial palmar arch. So it gives three perforating arteries which anastomose with the dorsal metacarpal arteries, and it also gives a recurrent branch which runs backwards to take part in the anterior carpal arch in front of the wrist joint, anterior carpal arch. Here anterior carpal arch is formed with a carpal branch of radial artery, ulnar artery, anterior interosseous artery, and recurrent branch from the deep palmar arch. Okay, so that is the formation of the deep palmar arch. Now if you look at these arteries and veins as they run through the digits, the nerves, what happens, will be present somewhat deeper, but as they reach the end of the fingers, they become superficial and they also run sideways. So they run towards the nail bed, that is the digital nerves. Why? Because they are going to supply your nail bed, your pulp, of the finger, your skin of the finger, they run sideways because so that during any grip, what happens is they should not get interrupted. Okay, so that is why they run more towards the sideways, the nerves as well as the arteries. So in the palm, the blood supply is mainly through the superficial palmar arch and the deep palmar arch. So these two palmar arches again can be expected as a short note, and deep branch of ulnar nerve can again be expected as a short note. So you have to write the course of the deep branch of the ulnar nerve, how it traverses, how it terminates, and what are the structures supplied by it. When they ask about the superficial and deep palmar arch, you should write about its formation, where actually it is situated at the lower border or upper border of the outstretched thumb, and what are all the branches given by the superficial palmar arch, and what are all the branches given by the deep palmar arches, and how do they supply the digits. So with this I complete the second part of the palm. So with this we have finished the palm of the hand, the muscles, the vessels and the nerves. I will meet again with a new lecture.